So, my name is Devin Lucero, and the genetic disorder that I've been looking at throughout the course is sickle cell disease. So, just a little bit about the gene. The gene that actually gets mutated is called the hemoglobin subunit beta, and just called HBB. It consists of 4 protein subunits. 2 subunits are called the alpha globin, and 2 units are called the beta globin. The HBB gene instructs for protein synthesis called beta globin, which is a smaller component and subunit of a larger protein called hemoglobin, which is located in the red blood cells. The gene is about 146 amino acids long, and it's located on chromosome 11. So the actual mutation of the gene, sickle cell anemia is a common form of sickle cell disease, and it's caused by a mutation of the HBB gene. It results in the production of an abnormal version of beta globin called hemoglobin S, or sometimes it's called HBS. When this mutation happens, hemoglobin S replaces both beta globin units in hemoglobin. And the mutation changes a single protein building block, or just amino acid, in beta globin. So this subunit is the one that's mutated. So the HBB gene mutations can also result in unusually low beta globin, and this is called thalassemia. In people with sickle cell disease, at least one of the beta globin subunits is replaced with that hemoglobin S. So this is what a normal red blood cell looks like, and this is the sickle cell. So the hemoglobin S gene is passed on with both parents are at least the carriers of the mutation, and it affects males and females equally, which is autosomal recessive pattern of inheritance. And so that means it's not unique to either the Y or the X chromosome, and recessive is just that the mutation can be present in both the mother and the father in order for the child to have sickle cell disease. But usually both parents are asymptomatic, and usually they don't even realize they're carriers. And so here's a pedigree of the sickle cell anemia. Here's also just to look at a general autosomal recessive inheritance pattern. So both parents have to be a carrier at least. They don't have to have actual disease. But if they are a carrier, then they will have an affected child. And then most of their children will be carriers, and then they'll have one unaffected child. Signs and symptoms of sickle cell disease usually begin in early childhood, and they're kind of characteristic of low number of red blood cells, which is anemia, and repeated infections and periodic episodes of pain. The disease is usually caused by the sickling of red blood cells. So when the red blood cells sickle, they break down prematurely, which can lead to anemia. And anemia can cause shortness of breath, fatigue, delayed growth, and development in children. It can also cause yellowing of the eyes and skin, which is also called jaundice. So the painful episodes that were mentioned in the previous slide, they occur when the sickled red blood cell, which becomes stiff and inflexible, they get stuck in the small blood vessels. These episodes then deprive the tissues and organs of oxygen-rich blood and can lead to organ damage. It can also lead to stress in the lung, pulmonary stress. It can also lead to high blood pressure and therefore cardiac disease, and honestly a whole lot of problems. But so here's again a normal red blood cell, and then the sickle cell, and they get stuck and they can block the blood vessel. So in order to identify the hemoglobin S mutation, a sickle cell test is pretty much a simple blood test used to determine if you have the disease or at least the sickle cell trait. People with sickle cell disease have red blood cells that are abnormally shaped. The sickle cells are shaped like we've seen before, like the crescent moon, and normal red blood cells just look like a donut. Newborns are routinely screened for genetic hemoglobin disorders. The doctor may also want to test your child if you just have a family history of abnormal blood disorders or if they have anemia that's not caused just by an iron deficiency. However, it can be tested in older adults and children if it's needed. So a secondary testing that can be used is called a hemoglobin electrophoresis test, and it's a blood test used to measure and identify the different types of hemoglobin in your bloodstream. So they look at all different types of hemoglobin, but specifically for sickle cell disease, we would be looking at the S hemoglobin. The levels of that hemoglobin electrophoresis test refer to a percentage of the different types of hemoglobin found in your blood. So when we see a large percentage of hemoglobin S, it's another indicator that there's probably sickle cell disease in the patient. And obviously people who have a family history of inherited anemias, such as thalassemia, which was mentioned earlier, or sickle cell anemia, may choose to screen for these genetic disorders before even having children, and they'll use this test. Some controversy with the testing. It's not really invasive per se, but some kind of controversy is when, especially in student athletes, they tried making it mandated that you had to have this testing done, either just a simple blood test or the hemoglobin electrophoresis, to identify if you had sickle cell disease, because there was a problem with student athletes getting overworked or practicing too hard without knowing that they had the disease, and it was either fatal or they ended up very sick in the hospital. So they tried to mandate that this test had to be done for each student, but then where the controversy came in was if they were positive for sickle cell disease, they would then be discriminated against and either wouldn't be selected for the team or wouldn't be able to participate with the other students as much or do the same practices. So that was really the only controversy that really goes along with this testing. And so just general prevalence. So sickle cell disease actually affects probably millions of people around the world. It's most common with people whose ancestors are from Africa, Mediterranean countries such as Greece, Turkey, and Italy, the Arabian Peninsula, India, and Spanish-speaking regions in South America, Central America, and parts of the Caribbean. Sickle cell disease is the most common inherited blood disorder in the United States. It affects about 70,000 to 80,000 of Americans. The disease is estimated to occur in 1 in 500 African Americans and 1 in 1,000 to 1,400 Hispanic Americans. And that's sickle cell disease.